Good afternoon. Thank you so much for joining us. I'm Suzanne Cohen. I'm the Senior Marketing Manager for NYU Langone Health, and I'm joined today by Dr. Karen Goodman, a pediatric emergency medicine specialist, Dr. Eleanor Muse, a pediatric pulmonologist, and Dr. Pantea Faramon, child and adolescent psychiatrist with a specialization in addiction psychiatry at Hassenfeld Children's Hospital at NYU Langone. Thank you so much for joining us, ladies.
Thank you.
Thank you.
Today we'll be discussing substance abuse use amongst our youth and the physical and mental health risks associated with it. I'll start here by noting that the CDC reports that 1 in 5 high school students, roughly 20%, reported having used e-cigarettes, also known as vaping. Do we find these numbers concerning? Dr. Muse, I'll start with you.
Thanks very much for having me. You know, vaping is a major problem for the youth and young adults here in New York and throughout the US. 1 in 5 students are vaping. And when I see patients in clinic for concern for vaping-related lung injury, which has been nicknamed EVALI, they are even reporting that more than that of their colleagues, their co-students, their classmates are vaping. This is a big deal facing our teens and young adults.
So with the evolution of going from cigarettes to vaping, can we talk about the risk associated with vaping specifically?
So the risks associated with vaping are pretty different than the risks associated with cigarette use, at least in the short term. The formulation of nicotine in vapes and e-cigarettes is a nicotine salt. And one of the main differences is that it's much higher concentration than the free-base nicotine in cigarettes. 1 pod per joule is equivalent to an entire pack of cigarettes. And nicotine salt crosses the blood-brain barrier almost instantaneously, making it a really high risk for addiction. In the short term, patients sometimes have shortness of breath or coughing, and in the long term, it's even more difficult to tell what's going to happen in the future. But even after 1 hit, kids can get addicted.
Wow, I didn't realize it was that quick to get addicted. Dr. Goodman, what are you seeing in the emergency rooms with teens coming in with vaping-associated injuries?
So I think the issue with the vaping-associated injuries is that we're taking normal kids, normal healthy kids who their respiratory issues, and when they get sick with respiratory illnesses, shouldn't be that bad. Most kids are resilient. They don't get very sick. They can handle a lot more than some other adults or some other sicker, people with other past medical histories have. And you get these kids that come in and they're just sicker, and we don't know why, and we don't expect it. And a lot of times we don't know it, and we don't know the history, or we don't know that they're vaping, and it's not something that they're that forthcoming and sharing. And that's part of the problem, is seeing these kids where we're not really sure why they're sicker. We're not really sure why their x-rays are worse than what we would expect from a typical kid who's giving us the same story. And it's hard to understand. And it definitely has, an impact on them. It has an impact on their diagnosis and the potential treatment. And I think part of the problem is that people aren't aware of that. So these kids don't realize the impact, even, I think like what Dr. Muse is saying, the short-term impact it can have on them and their health and their lung volume, and they're getting really sick, actually can make a big difference. And we also, the fact that we don't know, and it's not they're coming in and sharing all that with us so quickly, becomes a problem.
Is there a time frame which young adults, teens, tend to display these injuries? Is it once? Have they been smoking for a year, 2 years? Is there any, information around that?
This is such a good question, and one of the biggest challenges we have as physicians in making a diagnosis of EVALI, or at least raising suspicion for EVALI, because it can happen from 1 use, it can happen from a year of use. Because there's no regulation of vaping products or e-cigarettes, the contents of each individual pod or e-juice may be completely different. Early studies during the height of the EVALI epidemic evidenced marijuana vapes, specifically with vitamin E acetate, but that's not the only bad player in this. And we've certainly seen patients who have only ever used e-cigarettes with nicotine that have also come down with EVALI. So we don't know everything that's causing these injuries in kids, and we don't know the exact timeline. It really can be as varied from one use to years of use.
What are some signs and symptoms that children may be displaying if they're experiencing medical side effects from vaping and should see a specialist?
That's such a great question. Kids are often coming to the outpatient office complaining of cough as the main concern, and sometimes shortness of breath with exercise or activity. And that can present over any length of time. Sometimes patients report a cough that's productive of sputum, but not all the time. When they present to the emergency room, Dr. Goodman can speak to this more. We often see them in the ICU, and they may also present with cough, shortness of breath, but they often tend to be hypoxic or have low oxygen saturation in room air and may need supplemental oxygen to help support them.
Dr. Farriman, I didn't realize that vaping was so addictive. Just apparently one lovely hit of a vape. What are you seeing in terms of addiction issues with children as it associates to vaping?
So I think with all substances, and this includes stuff that we sometimes don't even consider to be addictive, one use of anything can potentially lead to addiction. In developing brains, this is particularly dangerous and concerning because the damages you won't know fully until they're adults, and it can change the course of development. In terms of nicotine vaping and marijuana vaping, we have the results of studies done from during the time of COVID and preceding COVID. Not a ton during the 2021 time because the year hasn't finished out. But the use of nicotine vapes and marijuana vapes has remained steady preceding COVID and the lockdown to now, which means that good news, the trend has not increased. However, it's concerning that during the time of lockdown when kids were in the home predominantly, they were still able to use just as much as they were using when there was less monitoring. And I think that speaks to the level of addiction of these substances. And I also think it speaks to maybe some mental health issues that come up when kids aren't allowed to do what's developmentally normal, which is be around other human beings.
What do parents need to know on how to talk to their children about the dangers of these substances? I will toss this to you, Dr. Goodman.
So I think parents need to know that it exists. I think parents need to know that it's for all comers. A good kid, a bad kid, you know, what you would consider a kid that is a good student, or a kid who maybe has done other substances in the past. Any kid can be doing this because it's around, and the kids don't realize that it's that bad, or they think, well, I'll just try it once, and then they just keep doing it, and it's the access is there for them. And I think parents need to be aware that no matter who it is, it's out there for their child to be exposed to, and they really need to open that conversation. They need to be non-judgmental on it so that they can have their kid be able to come to them, talk to them, and give them help in order to stop doing it. And have conversation even before it starts, to let a child know that this is something that may be offered to them, and to tell them up front, hey, you don't want to be even trying this, because, you know, it's not like, oh, I'm going to try it once and that's it. All my friends do it and it's fine, because it really can have a huge impact on their life. So I think parents need to be aware of it. They need to have that conversation. That conversation needs to start very young, because, you know, kids are seeing it earlier and earlier. It's not just in high school, it's in junior high and probably even earlier than that. And they just need to start those conversations and open it, because it really can make a big difference.
That's a great point. And Dr. Farriman, I'm going to follow that up with, are there conversation starters that parents can have? Questions that potentially wouldn't trigger a teen to, you know, back off? Are there things that parents should say that might open up the conversation?
Absolutely. And I think Dr. Goodman identified probably the most important way to open up the conversation, which is to approach the child in a non-judgmental manner. my thoughts are that a lot of these cases are going to be related to worsening anxiety and depression during the time of lockdown. So I think talking first with your primary care provider, your child's therapist, other people who are knowledgeable about what mental illness looks like, depression, anxiety, what does that look like in a kid? Because a lot of times before you'll find out about the addiction, you'll see a pattern of increased irritability, more social withdrawal, and then it'll become more problematic when the substances pick up, things like vaping and cannabis, but also things like alcohol and cough syrups and other things that we don't necessarily think of kids using. And I would say, having an open dialogue with the primary care physician to know what's out there, what's happening, and to know what to say. If you say the wrong things, it's okay, but just be mindful that you are not failing as a parent if your kid develops this problem. Your child is not a failure because they develop a problem with something like this. This is actually quite often the case in development, is to try risky things. So I think being non-judgmental, getting information from your pediatrician or your primary care provider that you trust for your child, and then also becoming familiar with the resources that are out there that are reputable. So some of the ones that I turn to and I trust are the website for the American Academy of Child and Adolescent Psychiatry, or acap.org. I like the FDA website for information as well. The SAMHSA website is great. MICPAP and Truth Initiative are also two great ones that I believe Dr. Muse is going to give a bit more information about as well.
Can I start a conversation with parents and patients about possible use exposure? I often start by asking them what their friends are into. It's so common that it makes it easy to throw it out there and not assume that the patient who's seeing you is or isn't, but rather I make it something that I just ask everyone because it's so common. I really need to know so that I can help them. And that has been a way that students and patients have been able to share with their parents, hey, actually, my best friends are using this and so am I, without it being quite so scary. So once it also becomes something more routine that we just ask everyone, it's a lot easier to throw out there and give some space and some opportunity for patients to answer.
Let's see. What other substances besides nicotine are children and teens vaping? There's so much conversation around THC and marijuana now. Are we seeing patients, consuming that through vape?
Most of the patients that I've seen for evaluation for vaping-related lung injury report that they're dual users of nicotine and marijuana vapes in one form or another. That's the majority of the patients that I'm seeing.
In some of the most current reports, the rate of marijuana vaping in 12th graders was 22%. Nicotine vaping was 34%. So there's a difference, but it's still quite a lot of kids that are using cannabis or marijuana in the vape. And it's much higher concentration as a vape than it was in whole plant versions that were available 20, 30 years ago.
For those that are just joining us, I am Suzanne Cohen, and part of the NYU Langone marketing team. I am joined here by Dr. Muse, Dr. Faramon, and Dr. Goodman, discussing substance use and the risks associated with it for a teen audience. Please feel free to leave your comments in the comment section so that we can address any questions that you may have. I do have one question coming in around addiction. What constitutes addiction, and what are some of the symptoms of withdrawal? Dr. Faramon, I will send that one to you.
So addiction is by definition a loss of control and use. A lot of times people will think that it is a voluntary mechanism or behavior because it involves putting something into your body. To some degree, it appears consciously. However, when you're meeting criteria for an addiction, you no longer have control of the use, and it requires a lot of changing of behaviors and oftentimes medications to help not to stop or decrease use. When we're thinking in terms of kids, a lot of these things are similar. There is a loss of control. There's more frequent use. There's a lot of triggers in their environment that are going to cue wanting to use a substance. But with kids, they have parents and they have other supports that can help change some of those behaviors. But it is more complicated and nuanced than I think most behavioral things. It's not like I choose to go and color one day. It's I need to do this at some point. Some symptoms of withdrawal that come with most substances are increased irritability, changes in sleep, changes in appetite, just feeling really unwell.
And are you seeing addictions being triggered by COVID-related anxieties? Returning to the classroom, I know, was a big discussion recently. There was a lot of anxiety around that. Any increase in addictions there?
So when we look at the amount of use that was happening during COVID, as I mentioned earlier, it has held steady. I think the outcomes in terms of addiction in the next few years, it's evolving and we'll see what happens. But it is likely that there will be an increase in addiction over the course of the next few years. In terms of returning to school, we are anticipating increased depression, increased anxiety, and challenges with adjustment, but we don't necessarily have the data right now.
I have another question. Dr. Muse, this one is for you. Is vaping any worse than cigarettes for children with asthma or allergies?
Such an interesting question. We know that young adults and youth with asthma choose e-cigarettes or vaping over cigarettes at a higher rate. We think it's because they believe it to be less harmful and it's considered a harm reduction strategy compared with cigarettes. Only the case is that's not true. Patients who have asthma are at just the same, if not higher risk for vaping-related lung injury because they already have lung pathology that makes it hard for them to breathe out. And when you put particles of nicotine and flavor chemicals that are already at risk for causing vaping-related lung injury, this compounds the issue. Fortunately, cigarette smoking remains at an all-time low, which really is a wonderful aspect to this conversation. Vaping, unfortunately, is not really a harm reduction compared to tobacco, traditional tobacco smoking and cigarette smoking.
We've heard the term before, vaped lung. Can you talk to us about what that is? And are you seeing an increase of teens with this condition? Dr. Muse or Dr. Goodman?
I think vape lung is really the term of what the insult to the lung is from vaping. And, I think Dr. Muse could probably talk a little bit more to the statistics and what she sees. I think, we see the patients that come in more acutely sick and probably hear a little bit more about the fact that it is a product of the insult from vaping much afterwards. But there is something about the changing in the lung itself, from the insult of having these chemicals and having these irritants affect the lung, which is basically, giving this terminology of vaping lung.
One of the challenges amidst the COVID-19 pandemic is that the CDC stopped tracking acute vaping-related lung injury hospitalizations in February of 2020. And when that happened, we stopped having a weekly update of the extent of the vaping epidemic. In my experience, the numbers are not dramatically decreased. We are still admitting patients. We are still seeing patients in the ICU with vaping-related lung injury. It is not at the same peak it was in September 2019, but it is still present and we are still seeing patients. So I remain concerned that vaping in youth is still a serious issue that we're facing.
Dr. Goodman, what other addiction-related issues are you seeing in the ED? Any household items that teens are getting a hold of, cough medicine and the like?
So I think those have always been issues that kids sort of will find anything that they can do and try to use it and play around with it. I think, again, it's hard to know. I think the lockdown had a lot of kids at home experimenting and playing and, finding things to kind of keep them busy. Cough suppressants have always been something that has been an issue that the kids play with. But a lot of these things are also things that kids do together. They sort of, find either something online or it's a lot of, sort of group activity. And I think now that the kids are all starting to come together, I think we're going to start to see a little bit more of that, where it's sort of they're sharing and it becomes a little bit more of a group activity with it. I think we do see other substance abuse as well. I think marijuana has become a big issue that we see. I think the access to it is definitely there. I think that the kids, teenagers don't realize how it impacts them, taking it almost on a daily basis, even if it's not, they don't think it's affecting their mood, they don't think it's affecting their life, and then they come in, vomiting, stomach aches, headaches, things like that, and don't realize that it's attributed to that. And by then it's very hard to sort of back off, because it's really become a part of their daily life. And we see a lot of it, and that's how we sort of find out about it, is when they come in with other symptoms. And I think now that there are some kids who are still home, and there's the issue with the isolation and the type of experimentation that's happening at home while alone. But now that kids are all starting to come out and I think experiencing a lot of anxiety about the return to socialization, as well as the opportunity to partake in many different activities, we're going to start to see more and more of this kind of activity. So not one thing in particular. I think it's just, in some ways, kids being kids, and it's going to continue to be that way.
Are we seeing long-term effects of vaping on teens' growth?
So one of the things I can speak to about long-term injury from vaping use, though this data is still coming out quite actively as we have more longer-term data, we do see hypoxia, as I mentioned before, or lower oxygen saturation in the early stages of vaping-related lung injury, and that tends to get better over time. But one thing that doesn't get better over time so far from the data that we have is the diffusing capacity of the lung, how easy it is for oxygen to get from the air that we breathe all the way down into our lungs and cross over into our blood. And in young people, that should be flawless. It's a beautifully designed system, and it should have absolutely no interruption and no difficulty. And what we are seeing in youth and young adults with vaping-related lung injury, with a decrease in their diffusing capacity, meaning it's much harder for oxygen to cross over and get into the blood because there's damage to that very delicate barrier between the air and the blood vessels. We don't know very long-term how this will evolve. Certainly there are some concerns that this could represent a very early COPD type picture. Time will tell.
I have a question that came in. My 17-year-old has been drinking with her friends on the weekends. What can I say to help her understand the dangers of alcohol when all of her friends are doing it? Dr. Faramon?
I think the most important thing is opening the conversation and showing some of the figures from the websites. I feel like I'm a little bit of an advertisement for the websites, but I'll show you a couple of examples. They have graphs on a lot of them that will show kids and have videos geared towards kids to give them information. So I think approaching the child non-judgmentally, telling them that you're worried, but you want them to be empowered with information, and then giving them the website. If you push too far in one direction, they're going to just shut down. It's almost like visually imagining a clam. If you poke too much, it's going to shut down. So you just want to open up the conversation, give them the information, and not push too much.
And can I just also add in something on
Absolutely.
that? Is really just the safety. I think I would sort of applaud that child for coming and talking openly with the parent, but also providing that child and their friends with sort of a safe person that if they're in trouble, when they're drinking, if they're out somewhere and feel like, you know what, we don't know what to do, someone drank too much, or at any point they feel unsafe, no one is home to, you know, no one's there to take them and drive them home, or any other concern that they have, that there's someone that they can go to, that there is someone who will be non-judgmental, who will be there in any second to help them, and maybe not even them, one of their friends. And having that sort of go-to person is very important for them, just to sort of, you know, put it out there. This is the number, this is the person. As a parent, I don't even need to know about it. I just need to make sure that, you know, if you or any of your friends are doing something that could become unsafe as well, that you know that you have somebody that can help you in that circumstance. And I think that that's very important, because I think a lot of what we happen to see are kids that end up in our emergency department when they've run into trouble, and a lot of their friends have sort of run away not knowing how to help them, or they don't know how to help themselves. And the parents are way more understanding, I think, than the kids ever expected that they would be, and really would have been there to help them, you know, many hours beforehand. And I think letting the child know that that's the case, or having somebody else that's there for them, is really, really important.
As a parent myself, I think that's a very strong message, to be very supportive of your teen. So echo those sentiments there. I do have another question. What is considered casual use versus addictive use of vaping? At what point are you considered addicted to?
There's a couple of different screening tools that people will use to try and elicit how the extent of the use. One of the common that I like to apply, but there's a number that you could find on various websites, but there's something called the CAGE criteria that's often used for assessing alcohol use, but can be applied to some degree to other substances. Does the child feel like they need to cut down on their use? Are they using more than intended? Are they using it to function? Is this something that's now become an unconscious mechanism? Like I'm starting to feel stressed, so I'm picking up the cigarette or the vape. Are they feeling annoyed that people are telling them to cut down? If you start to notice changes in your child's mood also, that can be an indicator that the use is getting out of control. They might either be withdrawing when they're not using, so they're more irritable and uncomfortable, or they might have some toxic episodes when they're using more than they intended to use.
We're down to the last few minutes here, and I just want to poll everybody to see if there's any other comments you'd like to share with our parents regarding vaping, signs and symptoms, resources that they may be able to use should they feel their teen is in a situation that may need assistance. And Dr. Muse, I'll start with you.
First thing really to do is talk to your kiddo. If they're 10, if they're 12, if they're 14, it doesn't matter how old they are. Start the conversation. Ask about what their friends are up to, what they're doing, before you ask about what they're up to and what they're doing. Make sure that they know that that window is open to always talk with you. And if you're concerned, bring it up with their pediatrician. Pediatricians are really fairly savvy with vaping use these days, and we're always here to help as well. So if there's additional levels of concern from your pediatrician, whether it's with vaping-related lung injury or other substance abuse, they can reach out to other experts in the field for additional consultation. So I think that's really the most important aspect. If you're looking for great resources for your kiddo or for you yourself, you can look at the Truth Initiative. It's pretty real life. They don't beat around the bush and they tell it like it is, which I think is really helpful for young people as well as parents. And as a parent resource, Parents Against Vaping E-Cigarettes is a group started in New York by two moms who had kids that were vaping. And they have a tremendous amount of resources on their website. You can join them and continue to lobby for stricter tobacco legislation, which I think is really helpful too.
Great. Dr. Goodman?
So I would echo what Dr. Muse said, but I would also add that at some point when a child doesn't want to speak to a parent, even if they feel that it's been offered many times, just to know that there are also other people that they can talk to, and to sort of offer that as a, I won't be offended, I won't be insulted, I don't need to be the one that you're talking to, but if there is an issue, to open that conversation, and open that conversation with some, some offers of other people and suggestions of who they may talk to, be it the pediatrician, and really allowing that pediatrician to have that one-on-one private time with, being able to talk to the child privately, which we do with all of our adolescents, to be able to ask these questions without a parent around, so that there is some other place where they can, reach out to somebody, talk to about it, ask the questions that they're afraid to talk to their parents about, or somebody else that they're afraid may tell their parent about. And also knowing that they can come to you about their friends, about themselves, or, there are many other people in their life that they can also trust, because it's important just to have that conversation open.
And Dr. Farahman?
So I would add that pay attention also to changes in your child's mood. If they're socially isolating more, if they're more irritable than usual, if they're arguing with you a lot more, this can indicate a mental health issue and or a substance use. So keeping feelers out for those sorts of changes can be helpful.
Fantastic. I thank you all for joining us. Thank you to everyone who was watching, and thank you to Dr. Goodman, Dr. Muse, and Dr. Farahman. We hope we provided some helpful information about substance use and risk, as well as how best to discuss the use of these products with your child. If you're interested in learning more, in addition to the sites offered by our experts here, or to speaking with one of our clinical experts more, please visit nyulangone.org. Thanks for joining us. Please click the like button on the Hassenfeld Children's Hospital page to learn about future Facebook Lives. Thank you.
Thank you.